What is hepatitis C? Hepatitis C is an infection of the liver caused by the hepatitis C virus, also called HCV. Be careful not to confuse it with hepatitis A, which is transmitted through contaminated food or water, or with hepatitis B, which is transmitted in the same ways as HIV. Like the hepatitis C virus, hepatitis A and B both attack the liver. Our liver is a vital organ that performs over 500 functions, cleans our blood, and plays a major role in digestion. On average, for every 10 people who contract HCV, 2 of them will recover on their own within 6 months. This process is called spontaneous clearance. For the others, the inflammation created by HCV becomes chronic. With chronic hepatitis C, the virus generates fibrosis, which is scar tissue that settles and accumulates between the liver cells. The liver shrinks and becomes harder and more fibrous over time. Fibrosis progresses through various stages until it reaches cirrhosis. Cirrhosis occurs when the liver has more and more difficulty fulfilling its role. This process can take 10, 20, or even 30 years, and in most cases, people living with hepatitis C have no symptoms, which is why it is called a silent disease. Fibrosis and cirrhosis also increase the risk of developing liver cancer. How is hepatitis C transmitted? HCV is transmitted primarily through blood and can survive for up to 6 weeks in open air or on surfaces. The most common modes of transmission are sharing equipment for drug preparation and use, whether by inhalation or injection, reusing surgical, medical, and dental equipment that has not been properly sterilized, having received a blood transfusion or organ transplant that was not screened for hepatitis C, reusing piercing, tattooing, or acupuncture equipment, or through sharing personal hygiene products that could have been in contact with blood, like razors, toothbrushes, or nail clippers. There is a low risk of transmission during sexual intercourse that only increases when blood is present. For example, with the practice of chemsex, BDSM, or in the case of anal penetration without a condom or fisting without gloves. The risk of vertical transmission is also quite low. So, to prevent the transmission of hepatitis C, use sterile, single-use equipment for drug use, make sure that the material used for your tattoos and piercings is sterile and single-use. Use your own toiletries. Use condoms and dental dams during sex. And, if you think you are at risk, get tested. Can hepatitis C be cured? A person living with hepatitis C can be cured with treatment. Depending on the medication and the state of one's liver health, someone living with the virus will need to take between 1 and 3 pills a day for 2 to 3 months. This treatment is more than 98% effective with very few side effects. Be careful. Unlike hepatitis A and B, against which you can be vaccinated, there is no vaccine that protects you from HCV. People who are undergoing treatment do not develop immunity to the virus. Therefore, there is a risk of reinfection after treatment if you are re-exposed to hepatitis C. Join the effort to eliminate hepatitis C by sharing this video and informing those around you.